With regard to going back to school, one thing that was left out of that discussion is mortality. I mean, shouldn't we at least be discussing what the mortality of children is? This is for Dr. Fauci as well. You know, the mortality between 0 and 18 in the New York data approaches 0. It's not going to be absolutely 0, but it almost approaches 0. Between 18 and 45, the mortality in New York was 10 out of 100,000. So really, we do need to be thinking about that. We need to observe with an open mind what went on in Sweden, where the kids kept going to school. The mortality per capita in Sweden is actually less than France, less than Italy, less than Spain, less than Belgium, less than the Netherlands, about the same as Switzerland. But basically, I don't think there's anybody arguing that what happened in Sweden is an unacceptable result. I think people are intrigued by it, and we should be. I don't think any of us are certain when we do all these modelings. There have been more people wrong with modeling than right. We're opening up a lot of economies around the U.S., and I hope that people who are predicting doom and gloom and saying, oh, we can't do this, there's going to be a surge, will admit that they were wrong if there isn't a surge, because I think that's what's going to happen. In rural states, we never really reached any sort of pandemic levels in Kentucky and other states. We have less deaths in Kentucky than we have in an average flu season. It's not to say this isn't deadly, but really outside of New England, we've had a relatively benign course for this virus nationwide. And I think the one-size-fits-all that we're going to have a national strategy and nobody's going to go to school is kind of ridiculous. We really ought to be doing it school district by school district, and the power needs to be dispersed because people make wrong predictions. And really the history of this, when we look back, will be of wrong prediction after wrong prediction after wrong prediction, starting with Ferguson in England. So I think we ought to have a little bit of humility in our belief that we know what's best for the economy. And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy, and the facts will bear this out. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year. And I think we ought to look at the Swedish model, and we ought to look at letting our kids get back to school. I think it's a huge mistake if we don't open the schools in the fall. Thank you.
Mr. Chairman, can I respond to that, even though there are only 32 seconds left?
Yes, and you might make it clear whether or not you suggested that we shouldn't go back to school in the fall.
Well, first of all, Senator Paul, thank you for your comments. I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. There are a number of other people who come into that and give advice that are more related to the things that you spoke about the need to get the country back open again and economically. I don't give advice about economic things. I don't give advice about anything other than public health. So I wanted to respond to that. The second thing is that you use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions. Thank you.
Dr. Hahn, in your testimony, you mentioned that the testing for the populations in the vaccine trials now includes older Americans. I guess my question, though, is what about children? Does it include children? Does it also include the obese, the diabetic, the immunocompromised, those who are at risk of having a non-response or a mitigated response to vaccination? Can you comment on that, please?
Yes, sir. Thank you, Senator Cassidy. When the phase 2, phase 3 trials are in place, they will include our most vulnerable populations, including the individuals that you described. we're working very closely with
So
Dr.
if I
Fauci's
can
group.
interrupt, phase two would
Yes, sir.
normally check for safety. You would not have to do a separate phase two in the patient who was younger. You follow what I'm saying, or can you just assume the safety data from the adults applies to that of the children?
So no, we would also want to assess safety, sir, as well, in children.
So the current phase two trials, do they include children?
They're in phase 1 studies right now, sir.
Well, I
to
thought
move
Dr.
to phase
Fauci
2.
said we had a phase two going on.
Well, I think it's about to start from the Moderna
No.
vaccine. Perhaps, Dr. Fauci, you can answer that.
Yeah, no, Senator Cassidy, no, I did not say a phase 2. As I said, we are in the second dose of the phase 1, and we will proceed when we finish with phase 1 to go into phase 2. We are not in phase 2
So I
yet.
think I'm hearing that children will be included in phase two trials?
No,
That's under discussion between FDA and NIH at this time, sir, because we do realize that it's important
Sounds
for
great.
us to understand what this is in children.
Dr. Redfield, to build back upon what Senator Murphy said, the published guidelines for school opening obviously you're about to modify, but I notice as I read through them, there's nothing about testing. So we speak about testing, targeted testing, how we use testing, but the guidelines for the school systems has nothing about how to integrate testing. Will these be in those guidelines that are being released?
Senator, thanks for the question. Clearly, there's going to need to be, as already been stated, an integration of a testing strategy that is going to be different, I think, for different school settings, as well as different jurisdictions where their schools are setting. And that is going to have to be integrated into each of those. There's a general overarching guidelines. And then, as I say, I do think the testing strategy, which is important, is including the surveillance strategy, needs to be a individualized.
No, let me comment on that,
development of
Dr. Redfield.
guidelines.
Dr. Redfield, in all due respect, I think children, whether you're rural, frontier, suburban, or urban, is the one setting in which there is a remarkable commonality. And I will echo what Senator Murphy said. The resources that the federal government has greatly exceeds all but the most sophisticated, populous, wealthy state. And even then, it exceeds it by some extent. So I do think it would be good to have, okay, in a primary school setting, this is best practices, or these are 3 options, and choose between one of these 3. To say to each school district or each private or parochial or independent school, work with your state board of health, figure it out, seems a wasted effort. I say that because children play such a role in both protection of disease, the spread of disease, et cetera. So your thoughts on that? Because it really seems that's the one setting where you can have, not cookie cutter, but certainly a pattern which can be followed.
Senator, I must have been misunderstood. When I was talking about differences, I was thinking of the difference between an elementary school, a high school, a college, in terms of how a trade school. There may be differences in how you integrate a testing strategy, but I do think having a testing strategy with different options for people to evaluate based on different principles will be important in terms of the guidance.
Dr. Fauci, you persuasively argue that the risk of reopening prematurely is great. But I think the frustration, if I think of children in particular, the risk-benefit ratio of a child being at home, potentially away from enhanced nutrition, without the parent able to work because school provides daycare, without the monitoring as sometimes occurs for incidences such as child abuse, but perhaps most importantly for all children, the opportunity cost of a brain which is forming, not having access to the information that will help that brain form optimally. Now, has there been any sort of kind of risk-benefit ratio for the child? Yes, they are at risk for Kawasaki's, but they are a particular risk for missing out on a year of education, particularly for those from less enriched backgrounds. I guess I'm very concerned about that tension. What are your thoughts on that?
No, you make a very good point, Senator Cassidy. That obviously very difficult of the unintended consequences of trying to do something that broadly is important for the public health and the risk of having a return or a resurgence of an outbreak, and the unintended deleterious consequences of having children out of school. We fully appreciate that. I don't have an easy answer to that. I just don't. We just have to see on a step-by-step basis as we get into the period of time with the fall about reopening the schools, exactly where we will be in the dynamics of the outbreak. I might point out something that I think has been alluded to throughout some of the questions, that we have a very large country and the dynamics of the outbreak are different in different regions of the country. So I would imagine that situations regarding school will be very different in one region versus another, so that it's not going to be universally or homogeneous. But I don't have a good explanation or solution to the problem of what happens when you close schools and it triggers a cascade of events that could have some harmful circumstances.
Mr. Chairman, I'll close by asking the permission of the chair to submit for the record an article that just came out in the Journal of Pediatric Nursing. Children are at risk from COVID-19.
It'll be so ordered and it'll be included. Thank you,
yield back.
Senator Cassidy.